Exercise and Lyme disease, how to start safely. This is part of a Common Sense Lyme series. I'm Dr. Daniel Cameron, where I share discussions I have in my practice. So let's begin. Now, Lyme disease uh, can be quite debilitating. I have people who are in bed on the couch, can barely leave the house. Of course, I have people who are working because they have to. They're doing the mom thing, the dad thing, as well as those who are in school. But it can be quite difficult for others. So I have to start out slow. Even people who can't walk across the room, can't leave the bed, need strength, need conditioning. But it's the right movement at the right time is important. So I'd like to start with addressing that people are quite sick. Sometimes they have a flare up, they have pain that's difficult to manage, they have difficulty walking, but they have to start somewhere. So I like to stabilize their illness, do the best I can, start pacing, start moving. Gentle movements are quite helpful if I can get started and build on it. There's 5 ways that I might use to reintroduce movement. Like in bed, they have stretches, ankle pumps, deep breathing. Most important thing is frequency. I might negotiate with 2 minutes of movement, then push a little harder over time as they accomplish some activities. But I don't like zero activity if I can help it. I also have to pay attention to the autonomic nervous system because they might not be able to stand up without being lightheaded. They might have to work on the floor. The and treatments of the infections important also. So even though I might be trying to focus on exercise, they might have a co-infection like babesia with air hunger and fatigue. So it's important to track the symptoms because the exercise might be helpful, but I have to balance exercise and the Lyme itself. Now, the barriers that keep my patients from moving can be pain, crushing, fatigue, post-exertional malaise. Plus, a lot of times they've relapsed before. There's some dizziness, vertigo, palpitations that might affect movements. There's shortness of breaths and air hunger that I see in babesia, but in other illnesses, it still can be important. Plus, all the emotional trauma of being sick for a while, limited in what they can do, the stigma of being sick for a long time, and various moods, including depression. So I had a patient that was bedridden for months, feared relapse with movement, but she started with some bed exercises, built up to walking indoors, later outdoors. And 6 months later, she could walk around the block with her child. Her words, "It feels like I have my life again." My final thoughts: exercise is not a cure, but it can certainly support my treatment. I always advise my patients to start small, listen to your body, but during the office visit, I celebrate even the tiniest wins. It's certainly been an important part of my treatment for Lyme disease, something that will help in the long run. Thank you for joining me for this Lyme disease and exercise common sense Lyme discussion. It's important to patients in my practice. So if you have any thoughts, comments, experiences, or disappointments, leave those in the comments section